Now to our weekly health check-in. Today we are talking traumatic brain injuries. There are more than 5 million Americans living with a permanent brain injury-related disability. To help us learn more, we turn to UofL Health and Dr. Sarah Wagers. Thank you so much for taking some time with us today, doctor.
Yes, I'm glad to.
So let's start with more on the diagnosis. What is a traumatic brain injury and are there different types?
Yes, so traumatic brain injury can run anywhere from mild to severe. For a mild traumatic brain injury, or what's known as a concussion, that's diagnosed when you have a blow to the head. It can be from a car wreck, it can be from sports or a fall. And anytime you have, after a blow to the head, you have a little bit of confusion. People say they might see stars. You just are a little bit of disoriented after that fall. That can be a concussion. And then it goes all the way up to a severe traumatic brain injury when you have different types of bleeding in the brain.
So you hit on it a little bit there with the seeing the stars, the confusion. Let's talk more about the symptoms. What should people be looking for and when is it time to go see your doctor?
Right. So if you or a loved one have a fall or some type of blow to the head, if the person is alert and oriented, they know where they are, they know what's going on, they're not having any symptoms, you really just have to monitor that. You don't have to go to the medical provider. However, if after a blow to the head, the person loses consciousness or starts acting confused or has headaches with nausea and vomiting or dizziness, problems with balance, those are times that you might want to go into the urgent care or the ER.
And are these kinds of injuries treatable? What can you do when you diagnose this injury?
Yes, so for a severe brain injury, you're going to be in the hospital and you're going to be treated in the hospital. For a concussion, you might see the ER, you might see your urgent care. If they diagnose you with a concussion, they're most likely going to send you to see your primary care provider. And you might have symptoms like headaches, trouble with your memory, mood irritability, and those things can be treated. Normally, after a concussion, for most people, those things will resolve within a week or so.
And what is one thing you wish the public better understood about these traumatic brain injuries?
I think the important thing is to know when to go to the doctor. And then the other thing is to know that if your symptoms continue past a week or two, you do need to kind of push getting treated for that. The earlier you get treated, the more likely you are to have a better outcome.
Excellent advice. Thank you so much for taking some time with us today, doctor.
You're welcome. Thank you.